Good morning, everyone. I'm Riley King, and welcome to this morning news report right here on the Riley King Network. Let's begin. Governor urges Granite Staters to get vaccinated as COVID-19 cases rise in New Hampshire. Sununu says he expects surge in fall to mostly hit unvaccinated communities. As COVID-19 cases continue to increase in New Hampshire, Governor Chris Sununu is urging Granite Staters to get vaccinated, saying it's the best way to get the virus in check. Sununu held a press briefing dedicated to the pandemic for the first time in more than a month Thursday, noting that New Hampshire just crossed the 100,000 mark of total cases throughout the pandemic. Sununu said the Delta variant of the virus has been driving the increase in cases across the country, and people who are unvaccinated make up most of the hospitalizations and deaths from COVID-19. He called vaccines safe, effective, and readily available. There are about 500 locations or ways to the vaccine here in New Hampshire, Sununu said. Literally down the street, wherever you are. There were 48 new cases announced Thursday, and the number of active cases rose to 308, the highest since mid-June. Dr. Benjamin Chan, the state epidemiologist, said the average number of daily new cases has been rising, as has the test positivity rate. One new death attributed to COVID-19 was reported Thursday. Chan said the average number of deaths each week has stayed low, but he said any death is now preventable. State health officials said the vaccines have been shown to be highly effective at preventing deaths. Since Granite Staters started to become fully vaccinated in early January, there have been about 600 deaths in the state attributed to COVID-19. 10 deaths have been in people who were fully vaccinated, according to Dr. Beth Daly, Chief of Bureau of Infectious Disease Control. Daly said there have been a total of 505 known breakthrough cases or cases of COVID-19 in fully vaccinated individuals. Sununu said that even though cases are rising in the state, there are no plans to implement new mask requirements or other restrictions. He said the state's focus is on encouraging everyone eligible to get vaccinated. The governor said he believes there will be a fall surge in cases that will primarily hit the state's unvaccinated population. My sense is we're going to see a continual rise, a slow rise in cases in the state for the next few weeks, at least similar to what was discussed earlier, Sununu said. I think there's an aspect of seasonality. Sure, we have 2/3 of our population vaccinated, maybe less, but when you look at the continued level of data variant, it's much, much higher. The vaccines currently in use are operating under an emergency use authorization, and Chan said full approval of one or more of the vaccines could happen within months. He said that might encourage more people to get vaccinated. Chan said some people who have already received their shot or shots might eventually need a booster. Given some of the emerging literature publications, particularly looking at immunity-composed people and whether they mount a full response to 2 doses of the vaccine, I think there's going to be a very active discussion and a high likelihood that certain populations, like the immune-composed, may need boosters, he said. To expand vaccination efforts, a new mobile vaccination unit is now in service and available to be booked for private and public events. So far, we've received more than 100 requests for the van, and we have events scheduled through September at this time, Daly said. We've been running the van now for about a week, and we've gone to 5 different locations and vaccinated about 50 people through the van. And that does it for this morning news report right here on the Riley King Network. Thank you for watching and have a great day. Goodbye.